Hi, I'm Annalie Delaney, student number T00792249. This is assignment number 3, skeletal system joints. And this is the list I'm going off of. So this long portion of the bone is the diaphysis, and then you have the epiphysis, and the epiphysis you can see it up here as well. And then we have the compact cortex bone. So that's that hard outer bone found there. And then the cancellous spongy bone, which you can see well up here. You can see it very well down here. And then we have the bone marrow. So I can actually cut it out here. So that would be yellow bone marrow. And then up closer to here, you can see a little bit of red bone marrow, I believe. And then the medulla, or the medulla cavity, that's that cavity that the bone marrow sits in. And that's found down the diaphysis of the bone. And in the epiphysis, we have the epiphyseal plates. So you can see those there, or the growth plates. And there's one down here as well, which is, you can see quite well. So the periosteum and the endosteum. So the periosteum lines the outer side of the bone, which you can separate, but I'm having a hard time trying to separate it. And then the endosteum lines the medullary cavity. And then up here in the joint itself, we have the synovial membrane, which is the membrane that lines in here between the ligaments and the bones. And the synovial membrane produces a fluid, which is the synovial fluid. You can kind of see it has that thick consistency. You can see it kind of well up there. So that would be the synovial fluid, which is also found down in here. And then we have the articular cartilage, which is most commonly made up of hyaline cartilage, and that lines the end of the bones so that it can glide smoothly whenever it's moving. So I have my other half here just to show. This is the patella, which is split in half, and whenever there's a lot of meat on this stifle, so it's hard to show, but when these are to sit together, where that femur meets in here is the trochlear groove, which is where the patella sits in there on either side. You can see the groove there, and this is a better view of that groove. And then the anterior and the posterior cruciate ligament. So this is the posterior cruciate ligament, and then on this side it would be this. It's kind of severed, so it's that one there. And then the anterior cruciate ligament is this one, which you can see better over here, that one right there. And then down through here you can see it as well as on this side. That is the patellar ligament. And the nutrient foramen, which I'm unable to find on this bone here, is the little hole in the diaphysis of the bone, usually at the proximal end, is where a blood vessel goes in and supplies all the nutrients to the bone in order for it to grow. So the joint capsule is a connective tissue that lines the joint. It's kind of hard to see here, but it's kind of just a thick membrane that lines the joint. So the tibial tuberosity, this is hard to get this to stay up here, is found up here. So that's the tibial tuberosity, and the tibial crest extends down from there. And then I believe they cut the fibula off, but that would have been found on the lateral side of the tibia. So this is the lateral collateral ligament, and this is the medial collateral ligament. So in here is the meniscus. It's that C-shaped cartilage in between the femur and the tibia. And then the medial and lateral condyles. So the medial condyle is this piece right here, and the lateral condyle is in there. That would be the lateral condyle. And then the epicondyle is this surface found here. So this is the medial and this is the lateral. The drawer test is a test that a veterinarian may do to determine whether the anterior or cranial cruciate ligament has been torn or ruptured. And what it is whenever you manually move the stifle joint to feel if that ligament is ruptured or damaged. So the difference between human medicine and veterinary medicine nomenclature in terms of cruciate ligaments: the anterior cruciate ligament is called the cranial cruciate ligament in vet med, and the posterior cruciate ligament is called the caudal cruciate ligament in veterinary medicine.